Hi, my name is John Thompson. I am one of the National Associate Clinical Directors at the Centre for Sustainable Delivery in NHS Scotland. Accelerated National Innovation Adoption, or ANIA, is a multi-organisation partnership between government and the NHS in Scotland. This partnership is coordinated by the Centre for Sustainable Delivery. ANIA is designed for a small number of key innovations that are proven technologies that are ready to scale across Scotland for the benefit of patients and staff and the country as a whole.
My name is Dr. Alex Doney and I work at the University of Aberdeen, but I'm also a stroke doctor at Ninewells Hospital in Dundee. I want to tell you about an improvement in healthcare that we've developed at the hospital here, and that is using common genetic variation in patients to improve the safety and effectiveness of the medications that we prescribe. In this case, this is a drug called Clopidogrel. Clopidogrel is a critical drug used to prevent heart attacks and strokes, and is particularly used to prevent further strokes when a patient unfortunately has had a stroke. One of the issues with Clopidogrel that has been known for a number of years is that in some people, Clopidogrel doesn't work very well and therefore isn't effective at preventing further strokes and heart attacks. These people can be very easily identified with a simple genetic test. And what we've been doing in NHS Tayside is getting this genetic test for patients for whom we want to prescribe Clopidogrel to. If they happen to be one of the approximately 25% of patients in whom Clopidogrel isn't going to work very well, we can then choose alternative, safer, more effective medications so that we can prevent or reduce the risk of further strokes and heart attacks. This kind of testing, when we use genetics to increase the effectiveness or safety of the medications that we prescribe, is known as pharmacogenomics. And for an increasing number of drugs that are prescribed commonly, we can use genetic testing in this way to make prescribing safer and better.
My name is David Beattie. I'm a consultant clinical scientist and head of laboratory for the NHS Genomics Service at NHS Tayside. This initiative involved the implementation, design and delivery of a simple genetic test that would inform the prescribing of Clopidogrel for stroke patients within NHS Tayside. It was important that we worked very closely with other healthcare professionals, but particularly pharmacists, so that they understood the impact of the genetic test on the prescribing and delivery of the medication that they were going to be offering. The genetic test is performed in a routine blood sample, and the results will determine whether the patient can be prescribed Clopidogrel or should be placed on an alternative, more effective antiplatelet that will help prevent the recurrence of stroke. Over the course of the 1-year pilot, 720 patients were referred for testing, and approximately 168 were transferred to an alternative antiplatelet medication that would be more effective for their treatment based on the genetic test results. As a consequence of this testing, it is estimated that approximately 17 patients were prevented from suffering a recurrent stroke based on the results of this genetic testing alone.
Hi, my name is Jess Henderson and I'm Associate Director for Access and Assurance in NHS Tayside. I've been in post for around a couple of years and previously had worked at the Centre for Sustainable Delivery. Within my remit, I've got a number of services, one of which is the genetics service. And early on when I started in post, I had a conversation with the genetics service who alerted me to a fantastic pilot they'd been undertaking. Within that pilot, they had been undertaking pharmacogenomics tests for people that had had a stroke. And the purpose of this test was to identify whether they can metabolize Clopidogrel. Around 75% of patients can metabolize it, 25% don't. And that means that medication doesn't work for them and leaves them vulnerable to a second stroke. They'd approached me because they were concerned that they were not going to be able to continue the service given it was a pilot, and locally I made sure that we'd embedded that and made it business as usual. However, having previously worked at the Centre for Sustainable Delivery and been part of the team that mobilised the Accelerated National Innovation Adoption Pathway, I'd also identified that this was a high-impact innovation which should be made available to everybody across the country. Part of the ethos of ANIA is very much about value-based innovations that are not available uniformly across the country that will make a significant benefit to patient care. I think it's moral and correct we are making this test available to anyone who's had a stroke to prevent the impact, the devastating impact of having a second stroke.